Welcome back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Topiramate, also known as Topamax. It is indicated for migraines and seizures, which can be used as monotherapy, meaning just use that alone to cure it, or it can be used as adjunctive therapy, meaning use it in conjunction with another medication for therapy. Off-label, it's also used for weight gain and binge eating disorder and kind of like all of those issues related to that. Let's see here, it's an anticonvulsant and it works by blocking your neurosodium channels, enhancing the GABA activity, and antagonizing the glutamate receptor. So that's kind of the most layman way I can put it, but essentially it works by balancing out your neurochemicals of certain ones. So you're firing a little extra heavy in your brain when you have those sodium channels. This works to kind of block that. That's why you're having migraines. Your migraines are throbbing and things like that. So this helps to kind of reduce that kind of activity in those and the activation of those receptors. Let's see here. Dosages are highly variable. You have Trokendi, which is the extended release version of it. You have immediate releases. Highly variable. If you're using an immediate release, just know that food doesn't affect the absorption or anything like that. However, if you're taking the extended release, eating a fatty meal will increase how much of that concentration gets into your bloodstream, but will decrease how long that drug is in, how long it works, essentially. So you'll peak quicker and then it'll get out of your body quicker because it'll attach to the fat molecules. Generally in children, if you're taking this, 1 to 3 hours is about the peak effect where you start to really feel it. With adults, I think it's closer to about 1 to 4 hours. It's a little bit longer. The extended releases, it takes about 24 hours. I mean, it's a long-acting kind of drug with the extended release. If you have renal issues, hepatic issues, you're the elderly, your clearance is reduced, meaning your body does not clear the medication out of its system or get it out of its system as quickly. So the Topiramate backs up. Now that's not necessarily good or bad, it's just things you have to make sure that your doctor knows about because they also know what other medications you're taking, what you're eating, things like that. So they know whether you're, because if the Topiramate backs up in your system, we need to give you a lower dose because it backs up. And we don't want it to back up too much, otherwise you start seeing side effects, toxic levels, and things like that. So, but if we know that your body's clearing it regularly, then we can give you higher doses of it. I'll put up a list of side effects right here. The main ones I want to talk about is it makes you susceptible to respiratory infections. Why that is, we don't really know, but it just does. We've seen it in practice. Drowsiness, dizziness, all the usual suspects. But also paresthesia, which is sort of like burning, tingling in your hands and feet, and you don't know why. Just random, we call them idiopathic. So watch out for that. If that happens, call your doctor. We need to switch you on to something else that works. We've also talked about the weight gain and the binge eating disorder. This has been paired with other drugs. I forget at the moment, is it Qsimia? I can't remember. But other drugs that are actually used for weight loss, they've started putting little amounts of Topiramate in there because it helps with it. Like phentermine and Topiramate together tends to kind of help. The research is still kind of middle of the pack about that. It's not necessarily the most convincing. It's not necessarily the weakest, but it's out there. So just watch out for that as well. As we get more information, we will always kind of update you guys on whether it's effective or not. But we are seeing it in therapy. And it seems to kind of work for some people. Guys, leave any concerns, comments below. Give us a subscribe. Let us know how we're doing with the channel. We just want to help with these videos. Alright guys, we'll see you next time on Meds Made Easy. Bye.